Question 1. When evaluating the potential risks of a new radiation therapy protocol for a patient with a complex medical history, which approach best aligns with the legal and ethical responsibilities of a radiation oncologist in ensuring patient safety and informed consent? Option A. Focusing the discussion with the patient solely on the technical parameters of the radiation delivery and the expected duration of treatment, without elaborating on potential side effects. Option B. Providing the patient with a generic information leaflet about radiation therapy risks and requiring them to sign a consent form without a personalized discussion of their specific situation. Option C. Conducting a detailed risk assessment that includes the probability and severity of potential radiation-induced toxicities, discussing these with the patient in understandable terms, and exploring alternative treatment options and their associated risks. Option D. Relying primarily on the published success rates of the new protocol and assuming the patient will experience similar outcomes, with minimal discussion of potential adverse events. The correct answer is C. Conducting a detailed risk assessment that includes the probability and severity of potential radiation-induced toxicities, discussing these with the patient in understandable terms, and exploring alternative treatment options and their associated risks. Explanation. This scenario presents a professional challenge for a radiation oncologist due to the inherent risks associated with radiation therapy and the paramount importance of patient safety and informed consent. The oncologist must balance the potential benefits of treatment with the known risks, ensuring that the patient fully understands these aspects before proceeding. This requires a thorough risk assessment that goes beyond simply listing potential side effects. The correct approach represents best professional practice because it prioritizes a comprehensive and individualized risk assessment. This involves not only identifying potential radiation-induced toxicities, but also considering the patient's specific medical history, comorbidities, and the precise treatment plan. By engaging in a detailed discussion with the patient, explaining the probability and severity of potential harms, and outlining mitigation strategies, the oncologist upholds the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm. Furthermore, this approach aligns with the regulatory framework emphasizing informed consent, where patients have the right to make autonomous decisions about their healthcare based on complete and understandable information. An incorrect approach that focuses solely on the technical aspects of radiation delivery, without a thorough patient-centered risk assessment, fails to adequately address the patient's well-being. This could be considered a regulatory failure if it leads to a lack of informed consent, violating the patient's right to self-determination. Another incorrect approach that downplays or omits potential serious side effects constitutes an ethical failure, as it breaches the duty of candor and honesty owed to the patient. Such an approach undermines trust and can lead to patient dissatisfaction and potential harm if unexpected complications arise. Professionals should employ a decision-making framework that begins with a thorough understanding of the patient's condition and the treatment goals. This is followed by a detailed assessment of the risks and benefits of the proposed therapy, considering all available evidence and patient-specific factors. Open and honest communication with the patient is crucial, allowing for shared decision-making. This involves explaining complex information in an accessible manner, addressing all patient concerns, and ensuring they have the capacity to understand and consent. Regular reassessment of risks and benefits throughout the treatment course is also a vital component of professional practice. Question 2. The control framework reveals that a research chemist has acquired a new spectroscopic instrument for material analysis. The chemist is unsure whether the instrument's emissions necessitate the rigorous safety protocol typically associated with radioactive sources, or if standard laboratory safety practices suffice. To make an informed decision regarding laboratory safety procedures and personnel training, what is the most critical factor the chemist must ascertain about the instrument's emissions? Option A. Whether the emitted radiation possesses sufficient energy to cause ionization of atoms or molecules. Option B. The perceived intensity of the emitted radiation as experienced by the human eye. Option C. The cost of the instrument and its operational budget. Option D. The novelty and complexity of the instrument's design. The correct answer is A. Whether the emitted radiation possesses sufficient energy to cause ionization of atoms or molecules. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent ambiguity in classifying radiation sources and the potential for miscommunication regarding safety protocols. A chemist working with a new analytical instrument must exercise careful judgment to ensure compliance with safety regulations and protect laboratory personnel. The core of the challenge lies in accurately distinguishing between ionizing and non-ionizing radiation, as the safety measures and regulatory oversight differ significantly for each. Misclassification can lead to either inadequate safety precautions, if ionizing radiation is underestimated, or unnecessary alarm and resource allocation, if non-ionizing radiation is overemphasized. Correct approach analysis. The correct approach involves a thorough understanding of the instrument's operational principles and the electromagnetic spectrum. This means consulting the manufacturer's specifications, relevant scientific literature, and the established guidelines for radiation safety as defined by the governing bodies relevant to the JEE/AIPMT curriculum. The JEE/AIPMT framework emphasizes fundamental physical chemistry principles, including the nature of electromagnetic radiation and its interaction with matter. Therefore, the best professional practice is to identify the specific type of radiation emitted by the instrument based on its energy levels and wavelength. If the instrument emits radiation with sufficient energy to cause ionization, i.e., remove electrons from atoms or molecules, it is classified as ionizing radiation, requiring strict adherence to radiation safety protocols, including shielding, monitoring, and personnel training. If the radiation lacks this energy and does not cause ionization, it is non-ionizing, and while still requiring safety considerations, the protocols are generally less stringent. This approach aligns with the principle of ALARA, as low as reasonably achievable, for ionizing radiation and general good laboratory practice for non-ionizing radiation, ensuring both safety and efficiency. Incorrect approaches analysis. One incorrect approach is to assume that any form of radiation emitted by a laboratory instrument is inherently dangerous and requires the most stringent safety protocols designed for high-energy ionizing radiation. This is incorrect because it leads to overregulation, unnecessary costs, and potential desensitization to genuine hazards. It fails to acknowledge the distinct properties and risks associated with non-ionizing radiation, which, while potentially harmful at high intensities, does not possess the same cellular damage potential as ionizing radiation. Another incorrect approach is to dismiss the need for any specific safety precaution simply because the radiation is not immediately perceived as harmful or because it falls into a category generally considered less hazardous. This is a failure to adhere to the precautionary principle and the regulatory requirement to assess and mitigate all potential risks, even those associated with non-ionizing radiation, such as potential thermal effects or long-term biological impacts that are still under investigation. A third incorrect approach is to rely solely on anecdotal evidence or the opinions of colleagues without consulting official documentation or expert guidance. This bypasses the established regulatory framework and scientific consensus, leading to potentially unsafe practices and noncompliance. Professional reasoning. Professionals in this field should adopt a systematic decision-making process. First, they must identify the specific instrument and its intended function. Second, they should consult the manufacturer's technical documentation to determine the type and energy of radiation emitted. Third, they must cross-reference this information with the established classifications of ionizing and non-ionizing radiation, as per the JEE/AIPMT curriculum scope. Fourth, they should consult relevant safety guidelines and regulations applicable to their laboratory environment, which are informed by the fundamental principles of physical chemistry. Finally, they should implement appropriate safety measures commensurate with the identified radiation type, prioritizing personnel safety and regulatory compliance. This structured approach ensures that decisions are evidence-based, scientifically sound, and ethically responsible. Question 3. The efficiency study reveals that early advancements in radiation therapy were primarily driven by which of the following foundational scientific principles and discoveries? Option A. The commercial exploitation of radium-based tonics and elixirs, which were marketed for a wide range of ailments. Option B. The discovery of radioactivity and the subsequent exploration of its properties for medical intervention. Option C. Anecdotal observations of skin reddening following exposure to early X-ray machines, leading to speculative therapeutic claims. Option D. uncontrolled experimentation with various radioactive isotopes without a clear understanding of their biological effects. The correct answer is B. The discovery of radioactivity and the subsequent exploration of its properties for medical intervention. Explanation. Scenario analysis. This scenario presents a challenge in understanding the historical context and ethical evolution of radiation therapy, specifically within the framework of its development for medical applications. The difficulty lies in discerning which historical advancements were driven by scientific inquiry versus those that might have been influenced by less rigorous or even ethically questionable early practices, all within the context of early 20th century scientific understanding and regulatory oversight, or lack thereof. The question requires an understanding of the foundational principles and early pioneers in the field, distinguishing between genuine scientific progress and anecdotal or speculative claims. Correct approach analysis. The correct approach recognizes that the early development of radiation therapy was significantly propelled by the discovery of radioactivity and its potential therapeutic applications. Pioneers like Marie Curie and Henry Becquerel, through their fundamental research, laid the groundwork. The subsequent application of radium and X-rays for treating diseases, though rudimentary by modern standards, represented a significant scientific and medical leap. This approach aligns with the historical narrative of scientific discovery leading to practical application, a core tenet of the history of science and medicine. The focus is on established scientific contributions and their direct impact on the development of the therapy. Incorrect approaches analysis. One incorrect approach might focus on speculative or unverified claims about early radiation effects that were not scientifically substantiated or ethically sound. For instance, attributing therapeutic success to practices that were later proven ineffective or harmful, without acknowledging the scientific rigor that eventually corrected these misconceptions, would be a failure. This ignores the scientific method and the iterative process of discovery and refinement. Another incorrect approach could overemphasize the commercialization or popularization of early radiation treatments without grounding it in the scientific understanding of the time. While commercial interests may have played a role, the fundamental development was driven by scientific investigation. Focusing solely on commercial aspects without the underlying scientific basis would misrepresent the history. A further incorrect approach might conflate early, uncontrolled experimentation with deliberate scientific advancement. While early pioneers were experimenting, their work was often guided by hypotheses and systematic observation, even if the understanding of radiation's biological effects was incomplete. An approach that presents all early uses as purely experimental, without acknowledging the scientific intent, would be flawed. Professional reasoning. Professionals should approach historical questions by prioritizing evidence-based accounts of scientific discovery and application. This involves distinguishing between established scientific contributions, theoretical advancements, and anecdotal or speculative claims. A decision-making framework would involve 1. Identifying the core scientific discoveries that enabled the technology. 2. Tracing the progression of research and its translation into practical applications. 3. Evaluating the scientific validity and ethical considerations of early practices based on the knowledge of the time and subsequent scientific consensus. 4. Recognizing the contributions of key figures and institutions in advancing the field through rigorous scientific methods. Question 4. The performance metrics show a significant reduction in tumor size following a course of radiation therapy, but patient-reported outcomes indicate a decline in quality of life due to persistent side effects. Considering the essential principles of physical chemistry as applied in radiation therapy, which of the following represents the most appropriate next step in patient management? Option A. Conclude that the treatment was successful based on the tumor shrinkage and focus future efforts on monitoring for recurrence. Option B. Conduct a thorough review of the patient's overall clinical status, including the severity and impact of side effects, and assess the long-term prognosis in light of both tumor response and quality of life. Option C. Discontinue all further patient follow-up, assuming the primary goal of tumor reduction has been achieved. Option D. Immediately initiate a new, more aggressive radiation treatment protocol to ensure complete eradication of any remaining tumor cells, irrespective of current side effects. The correct answer is B. Conduct a thorough review of the patient's overall clinical status, including the severity and impact of side effects, and assess the long-term prognosis in light of both tumor response and quality of life. Explanation: the scenario presents a professional challenge because it requires balancing the immediate need for effective patient treatment with the long-term implications of radiation exposure and the ethical imperative to minimize harm. Performance metrics, while indicating a positive outcome in terms of tumor reduction, do not capture the full spectrum of patient well-being, including potential side effects and the cumulative radiation dose. Careful judgment is required to interpret these metrics within a broader clinical context. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of patient outcomes beyond just tumor response. This includes evaluating the patient's quality of life, monitoring for acute and late radiation-induced toxicities, and ensuring that the radiation dose delivered was optimized to achieve therapeutic benefit while minimizing damage to surrounding healthy tissues. This aligns with the fundamental principles of patient-centered care and the ethical obligation to do no harm, as emphasized in medical professional guidelines that govern radiation therapy. It also reflects a commitment to continuous quality improvement by considering all relevant data points for treatment efficacy and safety. An incorrect approach that focuses solely on tumor shrinkage without considering patient well-being or potential adverse effects fails to uphold the ethical standard of beneficence and non-maleficence. This oversight could lead to overlooking significant treatment-related morbidity, potentially causing long-term harm to the patient. Such an approach would be professionally unacceptable, as it neglects crucial aspects of patient care and could violate established protocols for radiation therapy management, which mandate thorough patient monitoring and assessment of treatment-related complications. Another incorrect approach that might involve adjusting treatment parameters based on incomplete data or without a clear understanding of the underlying radiobiological principles would be a significant regulatory and ethical failure. This could lead to suboptimal treatment delivery, potentially compromising tumor control or increasing the risk of toxicity. It demonstrates a lack of adherence to evidence-based practice and could be seen as a deviation from accepted standards of care, potentially leading to adverse patient outcomes and professional repercussions. The professional decision-making process for similar situations should involve a systematic evaluation of all available data, including clinical response, patient-reported outcomes, toxicity profiles, and dosimetry. Professionals must critically analyze performance metrics, understanding their limitations, and integrate them with their clinical expertise and knowledge of radiation biology and physics. This holistic approach ensures that treatment decisions are not only effective, but also safe and aligned with the patient's overall well-being and the ethical standards of the profession. Question 5. The audit findings indicate a discrepancy in the reported radiation dose for a patient undergoing a diagnostic imaging procedure. The audit team has identified that the dosimetry calculation appears to be inconsistent with the expected range based on the equipment used and the procedure performed. To address this, the lead physicist is considering several approaches to reconcile the discrepancy. Option A. Reevaluate the calibration status of the radiation detection equipment and cross-reference the dosimetry calculation methodology with established physical principles and current scientific literature. Option B. Perform a visual inspection of the radiation source and detector to confirm they are physically intact, and proceed with the original calculation if no obvious damage is observed. Option C. Assume the initial calculation was correct and attribute the discrepancy to minor variations in patient anatomy without further investigation. Option D. Consult with a colleague who has experience with similar procedures and ask for their general opinion on whether the reported dose is reasonable, without reviewing the specific data. The correct answer is A. Reevaluate the calibration status of the radiation detection equipment and cross-reference the dosimetry calculation methodology with established physical principles and current scientific literature. Explanation: the audit findings indicate a potential lapse in the accurate measurement and calculation of radiation dose, a critical aspect of radiation safety and medical physics practice within the context of the JEE/AIPMT exam scope. This scenario is professionally challenging because it directly impacts patient safety, regulatory compliance, and the integrity of diagnostic or therapeutic procedures. Misinterpreting or misapplying dosimetry principles can lead to under- or overexposure, with significant health consequences. Careful judgment is required to ensure that all measurements and calculations adhere to established protocols and scientific principles. The correct approach represents best professional practice because it emphasizes a thorough, systematic, and evidence-based review of the dosimetry process. This involves verifying the calibration of equipment, cross-checking calculation methodologies against accepted standards, and understanding the underlying physical principles of radiation interaction with matter. Adherence to these practices ensures that the calculated dose accurately reflects the absorbed radiation, which is paramount for effective and safe medical applications of radiation, aligning with the fundamental objectives of physical chemistry in this domain. An incorrect approach that relies solely on visual inspection of equipment without verifying calibration data fails to address the potential for systematic errors. This is a regulatory failure, as it bypasses established quality assurance procedures mandated by the principles underlying radiation safety regulations. Even if not explicitly stated in the JEE/AIPMT framework, these principles are foundational. Another incorrect approach, which involves using outdated or non-validated calculation formulas, represents a scientific and ethical failure. It compromises the accuracy of the dose assessment, potentially leading to incorrect treatment planning or diagnostic interpretation, and violates the principle of using the most current and reliable scientific knowledge. A third incorrect approach, which dismisses discrepancies without further investigation, demonstrates a lack of due diligence and a failure to uphold professional responsibility. This can be seen as an ethical lapse, as it prioritizes expediency over accuracy and safety. Professionals should employ a decision-making framework that prioritizes accuracy, safety, and regulatory adherence. This involves 1. Identifying the core issue discrepancy in dosimetry. 2. Gathering all relevant data, equipment logs, calibration certificates, patient records, calculation sheets. 3. Applying established scientific principles and regulatory guidelines. Even if implicit in the exam scope, the underlying principles of accurate measurement and calculation are universal. 4. Evaluating different approaches for resolving the discrepancy based on their scientific validity and adherence to best practices. 5. Implementing the most robust and verifiable solution and documenting the process thoroughly. Question 6. Strategic planning requires a comprehensive understanding of radiobiological principles when assessing the impact of radiation therapy. Imagine a scenario where preliminary data from an in vitro study on a specific cancer cell line shows a particular survival curve after a single radiation dose. However, there is also evidence suggesting that these cells possess efficient DNA repair mechanisms. Considering the complexities of cell survival and repair in radiobiology, what is the most scientifically sound and ethically responsible approach to interpreting these findings for potential clinical application? Option A. Focus solely on the initial survival curve data, assuming that repair mechanisms, if present, would not significantly alter the immediate outcome of a single radiation exposure. Option B. Extrapolate the findings from this specific cell line to all other cancer types, assuming a universal response to radiation regardless of inherent repair capabilities. Option C. Thoroughly analyze the complete dose-response data, considering the known efficiency of cellular repair mechanisms and their potential to modify the observed survival curve, before drawing any conclusions about treatment efficacy. Option D. Immediately conclude that the observed survival curve accurately reflects the cell's sensitivity to radiation, as preliminary data is usually sufficient for initial clinical guidance. The correct answer is C. Thoroughly analyze the complete dose-response data, considering the known efficiency of cellular repair mechanisms and their potential to modify the observed survival curve, before drawing any conclusions about treatment efficacy. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a conflict between the immediate need for information to guide treatment and the ethical imperative to ensure the accuracy and integrity of scientific data. The pressure to provide a definitive answer quickly, especially in a medical context, can lead to premature conclusions or the misinterpretation of preliminary findings. Radiobiology, particularly concerning cell survival curves and repair mechanisms, is complex and influenced by numerous factors. Rushing to judgment without thorough analysis risks misinforming clinical decisions and potentially harming patients. Correct approach analysis. The correct approach, which involves a thorough review of all available data, including dose-response relationships, cell cycle effects, and known repair pathways, represents best professional practice. This aligns with the fundamental principles of scientific integrity and evidence-based medicine, which are implicitly expected in the JEE/AIPMT framework for understanding scientific concepts. It ensures that any conclusions drawn about radiobiological effects are robust, reproducible, and ethically sound, minimizing the risk of erroneous treatment recommendations. This approach prioritizes patient safety and the advancement of scientific knowledge over expediency. Incorrect approaches analysis. One incorrect approach would be to rely solely on initial, incomplete data from a single experiment to predict the overall cell survival. This fails to account for the inherent variability in biological systems and the potential for experimental error. Ethically, it breaches the principle of due diligence and could lead to incorrect treatment strategies based on insufficient evidence. Another incorrect approach would be to extrapolate findings from one cell type or experimental condition to another without considering the specific radiobiological characteristics of the target cells and the treatment environment. This ignores the nuanced nature of radiobiology, where repair mechanisms and survival curves can vary significantly. Such an approach is scientifically unsound and ethically irresponsible, as it could lead to ineffective or harmful treatments. A third incorrect approach would be to dismiss the possibility of cellular repair mechanisms influencing the observed survival curve simply because they are not immediately apparent in preliminary data. Cellular repair is a critical aspect of radiobiology, and overlooking its potential impact can lead to a flawed understanding of dose-response relationships. This demonstrates a lack of comprehensive scientific inquiry and could result in misjudging the efficacy of radiation therapy. Professional reasoning. Professionals facing such situations should adopt a systematic approach. First, clearly define the scope of the problem and the information required. Second, gather all relevant data, ensuring its quality and completeness. Third, critically analyze the data, considering all contributing factors, including experimental conditions and known biological mechanisms. Fourth, consult with peers or experts if necessary. Finally, communicate findings with appropriate caveats and a clear understanding of the limitations of the data. This structured decision-making process ensures that conclusions are well supported and ethically defensible. Question 7. The monitoring system demonstrates an unexpected fluctuation in the delivered radiation dose during a patient's treatment session, deviating slightly from the prescribed plan. Option A. Immediately halt the treatment, verify the system logs for the specific session, and consult with the medical physicist and radiation oncologist to assess the anomaly's significance and potential impact on patient safety and treatment efficacy. Option B. Assume the fluctuation is a minor system error and continue the treatment as planned, making a note to review the logs at the end of the day. Option C. Proceed with the treatment but increase the radiation dose in subsequent sessions to compensate for any perceived underdelivery during the anomalous period. Option D. Inform the patient that there was a minor technical issue and suggest rescheduling the remaining treatment sessions for safety reasons. The correct answer is A. Immediately halt the treatment, verify the system logs for the specific session, and consult with the medical physicist and radiation oncologist to assess the anomaly's significance and potential impact on patient safety and treatment efficacy. Explanation. This scenario presents a professional challenge due to the critical nature of radiation oncology treatment and the potential for patient harm if monitoring systems are not accurately interpreted and acted upon. The need for immediate and informed decision-making is paramount, balancing patient safety with treatment efficacy. The correct approach represents best professional practice because it prioritizes patient well-being and adherence to established safety protocols within the regulatory framework governing radiation oncology in India, as relevant to the JEE/AIPMT syllabus. This involves immediate verification of the anomaly, consultation with relevant experts, medical physicist, radiation oncologist, and a systematic investigation to determine the cause and implement corrective actions. This aligns with the principles of patient safety and quality assurance mandated by regulatory bodies overseeing medical practices, ensuring that treatment delivery remains within prescribed parameters and that any deviations are addressed promptly and effectively to prevent adverse events. An incorrect approach that involves ignoring the alert or assuming it is a false positive without proper investigation, represents a significant regulatory and ethical failure. It violates the principle of do no harm and disregards the established safety protocols designed to protect patients. Such an approach could lead to underdosing or overdosing of radiation, resulting in compromised treatment outcomes or severe side effects. Furthermore, it demonstrates a lack of due diligence and professional responsibility, potentially leading to disciplinary action and legal consequences under Indian medical regulations. Another incorrect approach, such as immediately stopping treatment without a thorough assessment, could also be professionally problematic. A caution is necessary. An abrupt halt without understanding the nature of the anomaly might unnecessarily disrupt the treatment plan, potentially impacting its effectiveness and causing patient anxiety. This approach fails to employ a systematic, evidence-based decision-making process. The professional decision-making process for similar situations should involve a structured approach. 1. Recognize and acknowledge the alert from the monitoring system. 2. Initiate immediate, but not necessarily drastic, action to investigate the anomaly. This includes reviewing system logs and performing preliminary checks. 3. Consult with the appropriate multidisciplinary team members, e.g., medical physicist, radiation oncologist, to gather expert opinions and collaboratively assess the situation. 4. Determine the root cause of the anomaly through systematic troubleshooting. 5. Implement corrective actions based on the identified cause. Ensuring patient safety is the primary consideration. 6. Document all actions taken, findings, and decisions thoroughly. 7. Communicate effectively with the patient and their family regarding any necessary adjustments to the treatment plan. This systematic process ensures that decisions are informed, evidence-based, and aligned with regulatory requirements and ethical obligations to provide the highest standard of care. Question 8. The assessment process reveals that a researcher has observed significant alterations in a biological sample after exposure to a controlled source of alpha particles. The researcher is attempting to explain these alterations solely based on the visual appearance of cellular damage, without a detailed consideration of the energy deposition mechanisms of alpha particles within the biological matrix. Which of the following represents the most scientifically sound approach to interpreting these observations, grounded in the principles of radiation interaction with matter as relevant to the JEE/AIPMT curriculum? Option A. Conclude that the observed changes are likely due to the sample's inherent instability and not the alpha particle exposure, as visual damage can be misleading. Option B. Assume that any observed cellular damage is a direct consequence of radiation, regardless of the specific interaction mechanisms, and proceed with reporting the findings. Option C. Prioritize the penetration depth of alpha particles, noting their limited range, and infer that the observed damage must be superficial and therefore unrelated to the bulk of the cellular structure. Option D. Focus on the characteristic high linear energy transfer, lead of alpha particles, and how this high energy deposition density leads to dense ionization tracts, causing localized, severe damage to critical cellular components like DNA, which aligns with the observed cellular morphology. The correct answer is D. Focus on the characteristic high linear energy transfer, lead of alpha particles, and how this high energy deposition density leads to dense ionization tracts, causing localized, severe damage to critical cellular components like DNA, which aligns with the observed cellular morphology. Explanation. Scenario analysis. This scenario presents a challenge in accurately interpreting the effects of radiation on biological samples, a common task in research settings. The difficulty lies in distinguishing between genuine radiation-induced damage and artifacts or natural variations within the biological material. Misinterpretation can lead to flawed conclusions, wasted resources, and potentially incorrect scientific publications. The need for precise understanding of radiation interaction with matter is paramount. Correct approach analysis. The correct approach involves a systematic evaluation of the observed changes, considering the known mechanisms of radiation interaction with biological molecules. This includes understanding how different types of radiation deposit energy, the resulting ionization and excitation, and the subsequent chemical reactions that can lead to cellular damage. A thorough understanding of these fundamental physical chemistry principles allows for the accurate identification of radiation-induced effects, differentiating them from other potential causes of change. This aligns with the scientific integrity expected in research, ensuring that findings are robust and reproducible. Incorrect approaches analysis. One incorrect approach might involve attributing all observed changes solely to radiation, without considering other factors. This fails to adhere to the scientific principle of falsifiability and rigorous investigation. It bypasses the need to establish a causal link based on established physical and chemical principles of radiation interaction. Another incorrect approach could be to rely on anecdotal evidence or superficial similarities to known radiation effects without a deep understanding of the underlying physical chemistry. This lacks the analytical rigor required for scientific conclusions and can lead to misdiagnosis of the cause of observed phenomena. It ignores the detailed energy transfer processes and subsequent molecular events that characterize radiation interaction. A further incorrect approach might be to dismiss any observed changes as insignificant or unrelated to radiation without proper investigation. This demonstrates a lack of thoroughness and a failure to explore all potential consequences of radiation exposure, even subtle ones that might be indicative of specific interaction pathways. Professional reasoning. Professionals facing such a scenario should employ a structured approach. First, clearly define the type of radiation and its energy spectrum. Second, recall and apply the fundamental principles of radiation interaction with matter, including concepts like linear energy transfer, LET, stopping power, and the types of secondary particles generated. Third, consider the specific biological molecules present and their known sensitivities to these interactions. Fourth, systematically compare the observed changes with the predicted outcomes based on these principles, looking for characteristic patterns of damage. Finally, consider and rule out alternative explanations for the observed changes before concluding that they are radiation-induced. This methodical process, grounded in the physical chemistry of radiation interaction, ensures accuracy and scientific validity. Question 9. Process analysis reveals that a patient presents with a localized, non-metastatic malignant tumor. Considering the essential principles of physical chemistry as applied to medical treatments, which of the following scenarios most accurately reflects an appropriate indication for radiation therapy? Option A. The patient's condition is a benign cyst that is causing mild discomfort, and radiation is suggested for its removal. Option B. The patient's condition is a minor viral infection, and radiation is proposed to boost the immune system. Option C. The patient's condition requires the use of radiation to induce targeted cellular damage and inhibit the proliferation of cancerous cells. Option D. The patient's condition is a superficial skin abrasion, and radiation is recommended for accelerated wound healing. The correct answer is C. The patient's condition requires the use of radiation to induce targeted cellular damage and inhibit the proliferation of cancerous cells. Explanation. Scenario analysis. This scenario presents a professional challenge in applying the principles of radiation therapy indications within the context of the JEE/AIPMT curriculum. The core difficulty lies in discerning the appropriate application of radiation therapy based on established medical guidelines, which are often complex and nuanced. Professionals must exercise careful judgment to ensure that treatment decisions align with patient needs and the scope of the examination's focus on physical chemistry essentials. Misinterpreting these indications could lead to inappropriate treatment recommendation, highlighting the critical need for accurate understanding and application of the subject matter, as presented in the exam's framework. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the established indications for radiation therapy as understood within the scientific and medical principles relevant to physical chemistry. This involves recognizing that radiation therapy is primarily indicated for the treatment of malignant tumors, where its cytotoxic effects can be leveraged to control or eradicate cancerous cells. The physical and chemical interactions of radiation with biological tissues are the fundamental basis for its therapeutic use in this context. Adherence to these established indications ensures that the application of radiation therapy is scientifically sound and ethically justified, aligning with the expected knowledge base for a JEE/AIPMT candidate. Incorrect approach is analysis. An incorrect approach would involve suggesting radiation therapy for conditions where it is not a primary or established treatment modality, such as benign conditions or general inflammatory processes. For instance, recommending radiation for a simple sprain or a common cold would be a significant failure. This is because the physical and chemical mechanisms of radiation therapy are not suited for treating such ailments, and its application would be medically inappropriate and potentially harmful. Ethically, it represents a deviation from standard medical practice and a failure to uphold the principle of do no harm. From a regulatory and examination perspective, it demonstrates a lack of understanding of the core principles and applications of radiation therapy as taught within the JEE/AIPMT syllabus, which focuses on scientifically validated uses. Another incorrect approach would be to suggest radiation therapy for diagnostic purposes, as its primary role is therapeutic, not imaging. Professional reasoning. Professionals should approach such situations by first identifying the patient's condition, and then cross-referencing it with established medical guidelines and the scientific principles underpinning the proposed treatment. In the context of radiation therapy, this means understanding its established role in oncology. Decision-making should be guided by evidence-based practice and the specific learning objectives of the JEE/AIPMT curriculum. When faced with uncertainty, seeking consultation with subject matter experts or referring to authoritative texts and guidelines is crucial. For exam preparation, this translates to a thorough understanding of the physical chemistry principles that explain why radiation therapy is effective for certain conditions and not others. Question 10. The risk matrix shows a moderate probability of a specific organ at risk receiving a dose exceeding its tolerance limit during stereotactic body radiation therapy, SBRT, for a lung tumor. Which of the following actions best represents a professional and safe approach to managing this identified risk? Option A. Conduct a thorough review of the treatment plan by the multidisciplinary team, exploring alternative beam arrangements or planning techniques to minimize the dose to the organ at risk while maintaining target coverage. Option B. Disregard the risk matrix findings as a routine part of the planning process and focus solely on achieving the prescribed target dose. Option C. Proceed with the current treatment plan, assuming the calculated dose is within acceptable limits and that the risk matrix is overly conservative. Option D. Arbitrarily reduce the prescribed dose to the lung tumor to ensure the organ at risk dose remains below its tolerance limit, without further re-evaluation. Correct answer is A. Conduct a thorough review of the treatment plan by the multidisciplinary team, exploring alternative beam arrangements or planning techniques to minimize the dose to the organ at risk while maintaining target coverage. Explanation. The risk matrix shows a moderate probability of a specific organ at risk or receiving a dose exceeding its tolerance limit during stereotactic body radiation therapy, SBRT, for a lung tumor. This scenario is professionally challenging because SBRT, while highly effective, involves delivering high doses of radiation to a small, precisely targeted area. The proximity of critical OARs to the target volume necessitates meticulous treatment planning and delivery to balance tumor control with minimizing toxicity. The inherent uncertainty in patient setup, internal organ motion, and beam delivery requires a robust risk assessment and mitigation strategy. The correct approach represents best professional practice because it prioritizes patient safety and adherence to established clinical guidelines and regulatory standards for radiation oncology. This involves a comprehensive review of the treatment plan by a multidisciplinary team, including radiation oncologists, medical physicists, and dosimetrists. This team would evaluate the dose distribution to the OAR, consider the impact of potential uncertainties, e.g., patient breathing, and explore alternative planning techniques or beam arrangements to further reduce the risk to the OAR. This collaborative, evidence-based approach ensures that the treatment plan is optimized for both efficacy and safety, aligning with the principles of ALARA, as low as reasonably achievable for radiation exposure to normal tissues. An incorrect approach would be to proceed with the current plan without further investigation, assuming the calculated dose is acceptable. This fails to acknowledge the potential for deviations from the planned dose due to biological and physical uncertainties inherent in SBRT. It also disregards the ethical obligation to minimize harm to the patient and may violate regulatory requirements for quality assurance and peer review in radiation therapy. Another incorrect approach would be to arbitrarily reduce the target dose to ensure the OAR dose is within tolerance, without considering the potential impact on tumor control. This could compromise treatment efficacy and is not a scientifically or clinically justified decision without a thorough re-evaluation of the benefit-risk ratio. A third incorrect approach would be to dismiss the risk matrix as an unreliable tool, thereby neglecting a critical component of quality assurance and risk management in radiation oncology. This demonstrates a failure to engage with established safety protocols and could lead to significant patient harm. Professional decision-making in such situations requires a systematic process. 1. Acknowledge and understand the identified risk. 2. Consult relevant clinical guidelines and regulatory standards. 3. Engage in multidisciplinary team review to assess the risk in the context of the specific patient and treatment. 4. Explore and evaluate mitigation strategies, considering their impact on both efficacy and safety. 5. Document the decision-making process and the rationale for the chosen course of action. 6. Implement the chosen plan with rigorous quality assurance measures. Question 11. Compliance review shows that a research team is proposing to administer an investigational therapeutic agent for a specific type of tumor, based on promising in vitro data and anecdotal observations from a few patients who received it compassionately outside of a formal trial. The team wishes to proceed with broader patient access immediately, citing the urgent need for treatment options. Which of the following represents the most appropriate and compliant course of action? Option A. Publish the preliminary in vitro findings and anecdotal reports to encourage other institutions to independently investigate the agent. Option B. Proceed with compassionate use protocols for individual patients, as deemed necessary by the treating physician, without formal trial oversight. Option C. Administer the agent to all eligible patients who express interest, documenting outcomes as they arise, to quickly gather real-world evidence. Option D. Initiate a formal clinical trial under the guidance of an ethics committee and regulatory authorities, ensuring rigorous data collection and patient safety protocols. The correct answer is D. Initiate a formal clinical trial under the guidance of an ethics committee and regulatory authorities, ensuring rigorous data collection and patient safety protocols. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a nuanced understanding of tumor biology and treatment response, specifically concerning the application of a novel therapeutic agent. The challenge lies in balancing the potential benefits of an experimental treatment with the established protocols and the need for rigorous scientific validation. Professionals must navigate the ethical considerations of patient care, the scientific integrity of research, and the regulatory landscape governing clinical trials and drug development. The decision-making process is complicated by the inherent uncertainties in early-stage research and the potential for unforeseen outcomes. Correct approach analysis. The correct approach emphasizes a systematic, evidence-based methodology that aligns with the principles of good clinical practice and regulatory guidelines for investigational new drugs. This involves a thorough review of preclinical data, a clear understanding of the proposed mechanism of action, and a well-defined protocol for patient selection and monitoring. Adhering to established Ethical Review Board (ERB) or Ethics Committee (EC) approval processes ensures that patient safety and rights are paramount. The focus on collecting robust data to assess efficacy and safety is crucial for determining the therapeutic potential of the agent and informing future clinical decisions. This approach represents best professional practice because it prioritizes patient well-being, scientific rigor, and compliance with the regulatory framework governing research and development, ensuring that any potential advancement is built on a foundation of sound evidence and ethical conduct. Incorrect approaches analysis. An approach that bypasses standard ethical review and regulatory oversight for an investigational agent, even with promising preliminary results, constitutes a significant regulatory and ethical failure. This disregards the fundamental principle of protecting human subjects in research. Proceeding without a clear understanding of the drug's mechanism of action or potential toxicities, based solely on anecdotal evidence or limited in vitro studies, is scientifically unsound and ethically irresponsible. Such an approach risks patient harm and undermines the integrity of the research process. Furthermore, administering an unapproved therapeutic agent outside of a controlled clinical trial setting, without proper documentation and oversight, violates regulations pertaining to drug administration and research conduct. This can lead to inaccurate data, misinterpretation of results, and potential legal repercussions. Professional reasoning. Professionals facing such a scenario should employ a decision-making framework that prioritizes ethical considerations, regulatory compliance, and scientific validity. This involves 1. Information gathering, thoroughly reviewing all available preclinical and early clinical data, understanding the proposed mechanism of action, and identifying potential risks and benefits. 2. Ethical and regulatory consultation. Consulting with institutional review boards or ethics committees and regulatory affairs departments to ensure all research and treatment plans adhere to applicable laws and guidelines. 3. Protocol development. Designing a rigorous clinical trial protocol that clearly defines patient eligibility criteria, treatment regimens, endpoints for efficacy and safety assessment, and data collection procedures. 4. Risk-benefit assessment. Conducting a comprehensive assessment of the potential risks to patients versus the potential benefits of the investigational therapy. 5. Informed consent. Ensuring that potential participants are fully informed about the experimental nature of the treatment, its potential risks and benefits, and their right to withdraw at any time. 6. Monitoring and evaluation. Establishing robust systems for monitoring patient safety and treatment response throughout the trial, and for analyzing the collected data objectively. Question 12. Stakeholder feedback indicates that some patients undergoing palliative radiation therapy express confusion and disappointment regarding the treatment's ultimate aims. A medical team is discussing how to best communicate the purpose of palliative radiation therapy to a patient with advanced cancer whose primary goal is to manage pain and improve their quality of life, while acknowledging the patient's underlying hope for remission. Which of the following approaches best aligns with the principles of palliative care and ethical medical practice? Option A. Emphasize that the radiation therapy is designed to alleviate symptoms such as pain and nausea and to improve overall comfort and quality of life, while acknowledging that it is not intended to cure the cancer. Option B. Focus on the advanced technology and precise targeting of the radiation beams, implying that such sophisticated treatment inherently leads to significant tumor reduction and potential remission. Option C. Explain that the radiation therapy is a standard part of cancer treatment and proceed with the treatment plan without explicitly detailing the palliative nature, assuming the patient understands the shift in goals. Option D. Highlight the possibility of unexpected positive responses and significant tumor shrinkage, even in advanced stages, to maintain the patient's hope for a cure. The correct answer is A. Emphasize that the radiation therapy is designed to alleviate symptoms such as pain and nausea, and to improve overall comfort and quality of life, while acknowledging that it is not intended to cure the cancer. Explanation. This scenario presents a professional challenge due to the inherent tension between providing effective palliative care and managing patient expectations within the constraints of available resources and established medical protocols. The core difficulty lies in clearly communicating the goals of palliative radiation therapy, which are symptom relief and quality of life enhancement, rather than cure, to a patient who may still harbor hopes of complete remission. Careful judgment is required to ensure that the patient's understanding aligns with the medical team's capabilities and intentions, fostering trust and avoiding disappointment or a sense of abandonment. The correct approach represents best professional practice because it prioritizes patient-centered communication and informed consent, which are fundamental ethical and regulatory requirements in healthcare. By clearly articulating that the primary objective is symptom management and improved comfort, the medical team aligns with the established goals of palliative radiation therapy. This approach respects the patient's autonomy by providing them with accurate information to make decisions about their care, and it upholds the ethical principle of beneficence by focusing on improving their quality of life. Adherence to these principles is implicitly mandated by the overarching regulatory framework governing medical practice, which emphasizes transparency, patient well-being, and the provision of appropriate care. An incorrect approach that focuses solely on the technical aspects of radiation delivery, without addressing the patient's emotional and informational needs, fails to meet the ethical standard of compassionate care. It risks creating a disconnect between the patient's understanding and the treatment's actual purpose, potentially leading to feelings of betrayal or neglect when curative outcomes are not achieved. This approach could be seen as a failure to adequately inform the patient, a breach of the duty of care, and a disregard for the patient's right to understand their treatment trajectory. Another incorrect approach that overpromises potential curative benefits, even if technically possible in rare instances, is ethically unsound and potentially violates regulatory guidelines against misleading patients. Palliative care, by definition, shifts the focus from cure to comfort when curative options are no longer feasible or are outweighed by the burden of treatment. Misrepresenting the goals of palliative radiation therapy can lead to false hope, unnecessary distress, and a breakdown of trust between the patient and the healthcare team. This constitutes a failure in honest communication and can have significant negative psychological impacts on the patient. The professional decision-making process in such situations should involve a structured approach to patient communication. This includes 1. Assessing the patient's current understanding and expectations regarding their prognosis and treatment. 2. Clearly and empathetically explaining the goals of palliative radiation therapy, emphasizing symptom relief and quality of life. 3. Discussing the potential benefits and limitations of the treatment in a way that is understandable to the patient. 4. Actively listening to the patient's concerns and addressing them honestly. 5. Involving the patient in shared decision-making, ensuring their consent is informed and voluntary. This process ensures that care is delivered ethically, effectively, and in alignment with regulatory expectations for patient well-being and informed consent. Question 13. Benchmark analysis indicates that understanding the fundamental properties of different types of radiation is crucial for physical chemistry concepts. Considering the interaction of radiation with matter, which of the following statements best describes a key difference in the behavior of alpha particles compared to gamma rays when passing through a solid material? Option A. Alpha particles have a very short range and high ionization power, causing significant localized damage, whereas gamma rays are highly penetrating with lower ionization power per unit path length. Option B. Alpha particles are highly penetrating due to their low ionization potential, while gamma rays are less penetrating due to their high ionization potential. Option C. Alpha particles are electromagnetic waves with no mass, while gamma rays are charged particles with significant mass. Option D. Gamma rays are easily stopped by a thin sheet of paper, while alpha particles can penetrate several centimeters of lead. The correct answer is B. Alpha particles are highly penetrating due to their low ionization potential, while gamma rays are less penetrating due to their high ionization potential. Explanation: scenario analysis. This scenario presents a challenge in applying fundamental principles of radiation physics within the context of an exam preparation setting. The difficulty lies in ensuring that the question and its options accurately reflect the scope and depth expected for JEE/AIPMT, which emphasizes conceptual understanding and application of physical chemistry principles, rather than rote memorization or overly complex theoretical tangents. The professional challenge is to create a question that is both relevant to the syllabus and discriminates effectively between students who have a solid grasp of the topic and those who do not, all while adhering to the strict constraints of the exam's regulatory framework. Correct approach analysis. The correct approach involves formulating a question that probes the understanding of how different types of radiation interact with matter, a core concept in physical chemistry relevant to radiation physics. This aligns with the JEE/AIPMT syllabus, which often includes topics like atomic structure, nuclear chemistry, and the properties of electromagnetic radiation. A question that requires students to differentiate between the penetrating power or ionization potential of alpha, beta, and gamma radiation. For instance, tests their conceptual understanding of the fundamental differences in their nature and interaction mechanisms. This represents best professional practice because it directly assesses the learning objectives for the exam, focusing on the essentials of physical chemistry, as mandated. It avoids mathematical calculations, thereby adhering to the variety requirements, and instead tests the application of theoretical knowledge. Incorrect approach is analysis. An incorrect approach would be to ask a question that delves into the detailed quantum mechanical interactions of radiation with complex biological systems, as this goes beyond the scope of essentials of physical chemistry for JEE/AIPMT and ventures into more specialized fields like medical physics or radiobiology. Another incorrect approach would be to pose a question that requires knowledge of specific radiation detection equipment or safety protocols beyond the basic understanding of radiation properties. Such questions would fail to align with the specified exam's regulatory framework and curriculum. Furthermore, any question that necessitates complex calculations or the recall of obscure constants or formulas would also be considered an incorrect approach, violating the requirement to avoid math-focused questions and the emphasis on conceptual understanding. Professional reasoning. Professionals preparing exam questions must first thoroughly understand the defined scope and objectives of the examination. They should then brainstorm question ideas that directly assess these objectives, ensuring a balance between conceptual understanding, application, and theoretical knowledge. The next step is to critically evaluate each potential question against all specified constraints, including topic relevance, avoidance of specific question types, like heavy calculation, and adherence to the regulatory framework. Finally, the question and its options should be reviewed to ensure clarity, accuracy, and fairness, guaranteeing that they effectively differentiate between levels of understanding within the target student population. Question 14. The risk matrix shows a moderate risk of complications for a novel, minimally invasive surgical technique compared to a higher risk of long-term morbidity with a traditional open surgical approach for a patient with a specific cardiac anomaly. The available technologies include advanced robotic-assisted surgery for the minimally invasive option and standard surgical instruments for the open procedure. Considering the patient's age and overall health status, which treatment planning approach best aligns with the principles of patient safety and effective care within the Indian regulatory framework? Option A. Opt for the traditional open surgical approach because it is a well-established procedure with predictable outcomes, despite the higher risk of long-term morbidity. Option B. Select the minimally invasive robotic-assisted surgery solely based on its technological advancement and perceived prestige, without a thorough patient-specific risk-benefit analysis. Option C. Recommend a conservative medical management approach without surgical intervention, as the risk matrix indicates some level of risk for both surgical options. Option D. Prioritize the minimally invasive robotic-assisted surgery due to its lower immediate risk of complications, as indicated by the risk matrix, after a detailed discussion with the patient about the potential benefits and the specific risks associated with this newer technology. The correct answer is D. Prioritize the minimally invasive robotic-assisted surgery due to its lower immediate risk of complications, as indicated by the risk matrix, after a detailed discussion with the patient about the potential benefits and the specific risks associated with this newer technology. Explanation. The scenario presents a challenge in selecting the most appropriate treatment planning technique for a patient with a complex condition, requiring a balance between efficacy, patient safety, and resource utilization. The professional challenge lies in interpreting the risk matrix, which quantifies potential adverse outcomes associated with different treatment modalities, and aligning this with the patient's specific needs and the available technologies. Careful judgment is required to avoid overtreatment or undertreatment, ensuring adherence to established medical guidelines and ethical considerations. The correct approach, which involves a thorough review of the patient's medical history, diagnostic imaging, and a comprehensive understanding of the risk matrix's implications for each treatment option, represents best professional practice. This aligns with the principles of evidence-based medicine and patient-centered care, mandated by the National Medical Council, NMC, Guidelines for Professional Conduct and Ethical Practice in India. Specifically, the NMC emphasizes the physician's duty to provide the best possible care based on the latest scientific knowledge, and to involve the patient in decision-making after explaining all available options and their associated risks and benefits. This approach ensures that the chosen treatment plan is not only clinically sound, but also ethically justifiable and respects patient autonomy. An incorrect approach that solely relies on the newest or most technologically advanced treatment, without a detailed risk assessment and consideration of patient-specific factors, is professionally unacceptable. This would violate the NMC's emphasis on judicious use of resources and avoiding unnecessary interventions, potentially leading to patient harm and financial burden. Another incorrect approach, which prioritizes a treatment based on its perceived ease of implementation or familiarity to the clinician, without a rigorous evaluation of its suitability for the patient's specific condition, as indicated by the risk matrix, demonstrates a failure to uphold the principle of providing optimal care. This can lead to suboptimal outcomes and potential complications, contravening the NMC's mandate for competence and diligence. The professional decision-making process for similar situations should involve a systematic evaluation. First, understanding the patient's condition and all relevant clinical data. Second, thoroughly analyzing the risk matrix to identify potential benefits and harms of each treatment option. Third, considering the patient's preferences, values, and socioeconomic factors. And finally, selecting the treatment plan that offers the best risk-benefit profile, is ethically sound, and aligns with current medical best practices and regulatory guidelines. Question 15. Assessment of a 65-year-old male patient with a newly diagnosed stage Roman III lung carcinoma reveals a positive PET-CT scan indicating localized disease. The patient has a history of moderate chronic obstructive pulmonary disease, COPD, and is on regular medication for hypertension. Considering these factors, which of the following approaches best aligns with the essential principles of patient assessment and selection for radiation therapy in the context of JEE/AIPMT exam prep? Essentials of physical chemistry, focusing on regulatory compliance and patient safety. Option A. Conduct a thorough review of the patient's pulmonary function tests, cardiac status, and overall performance status, and consult with a pulmonologist and cardiologist to assess the risks and benefits of radiation therapy before finalizing the treatment plan. Option B. Initiate radiation therapy immediately to capitalize on the localized nature of the disease, deferring a detailed assessment of comorbidities until after the initial treatment phase. Option C. Proceed with definitive radiation therapy as planned based on the PET-CT findings, assuming the COPD and hypertension are manageable with current medications. Option D. Rely solely on the PET-CT report to confirm the extent of the tumor and proceed with radiation therapy, as this is the primary diagnostic tool for staging. The correct answer is C. Proceed with definitive radiation therapy as planned based on the PET-CT findings, assuming the COPD and hypertension are manageable with current medications. Explanation. This scenario presents a professional challenge due to the critical need for accurate patient assessment prior to radiation therapy, directly impacting treatment efficacy and patient safety. The complexity arises from integrating diverse patient information, including medical history, physical examination findings, and diagnostic imaging, to determine suitability and optimize treatment planning. Careful judgment is required to avoid potential harm and ensure adherence to established protocols. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted evaluation of the patient. This involves a thorough review of all available diagnostic data, a detailed understanding of the patient's overall health status beyond the immediate condition requiring radiation, and consideration of potential contraindications or factors that might necessitate alternative treatment strategies. This holistic assessment ensures that radiation therapy is not only indicated, but also the safest and most effective option, aligning with the principles of patient-centered care and evidence-based medicine, which are foundational to the regulatory framework governing medical practice in India, as emphasized by guidelines from the Atomic Energy Regulatory Board (AIRB) and professional medical bodies. An incorrect approach that relies solely on a single diagnostic report, such as a biopsy result, fails to account for the patient's broader clinical picture. This could lead to overlooking comorbidities that might increase radiation-related risks or contraindicate the proposed treatment, violating the ethical duty of care and potentially breaching AIRB guidelines that mandate a comprehensive risk-benefit analysis. Another incorrect approach, which involves proceeding with treatment based on a preliminary or incomplete set of investigations, demonstrates a disregard for due diligence and the established protocols for patient selection. This not only compromises treatment outcomes, but also exposes the patient to unnecessary risks, a clear violation of medical ethics and regulatory requirements for thorough pre-treatment evaluation. A third incorrect approach, which might involve deferring the assessment of patient suitability to a junior resident without adequate supervision, represents a failure in professional responsibility and oversight. This can lead to errors in judgment and a lack of accountability, contravening the hierarchical and supervisory structures mandated by medical regulatory bodies to ensure patient safety. The professional decision-making process for similar situations should involve a systematic approach. First, gathering all relevant patient data. Second, critically analyzing this data in the context of established clinical guidelines and regulatory requirements. Third, identifying potential risks and benefits associated with radiation therapy. Fourth, consulting with multidisciplinary teams when necessary. And finally, documenting the rationale for the chosen treatment plan, ensuring transparency and accountability. Question 16. Comparative studies suggest that the integration of radiation therapy, chemotherapy, and surgical intervention in cancer treatment can lead to improved local control and survival rates. Considering the principles of process optimization in a clinical setting, Which of the following strategies best reflects a scientifically sound and ethically responsible approach to determining the optimal sequence and combination of these modalities for a specific patient? Option A. Prioritizing a treatment modality that has shown the most significant individual efficacy in preclinical models, irrespective of potential additive toxicities or synergistic effects with other planned treatments. Option B. Developing a treatment plan based on a consensus from a multidisciplinary tumor board, integrating patient-specific factors, current evidence-based guidelines, and the potential for synergistic or antagonistic interactions between radiation, chemotherapy, and surgery. Option C. Selecting the treatment modality that is most readily available and least resource-intensive, even if it means deviating from established optimal treatment pathways. Option D. Administering all three modalities concurrently at maximum tolerated doses to achieve the most aggressive tumor debulking possible in the shortest time frame. Correct answer is A. Prioritizing a treatment modality that has shown the most significant individual efficacy in preclinical models, irrespective of potential additive toxicities or synergistic effects with other planned treatments. Explanation. This scenario presents a professional challenge due to the complex interplay of different treatment modalities and the need to optimize patient outcomes while adhering to established medical protocols. The decision-making process requires a deep understanding of the synergistic effects of radiation, chemotherapy, and surgery, as well as their potential toxicities and the patient's individual characteristics. The goal is to achieve the most effective tumor control with the least amount of harm, a core principle in oncological practice. The correct approach represents best professional practice because it prioritizes a multidisciplinary team's consensus, informed by the latest evidence-based guidelines and the patient's specific clinical situation. This collaborative approach ensures that all available treatment options are considered, their benefits and risks are weighed comprehensively, and a personalized treatment plan is developed. This aligns with the ethical imperative to provide patient-centered care and the regulatory expectation for adherence to established standards of care, which are often informed by professional bodies and clinical trial data. An incorrect approach that focuses solely on maximizing the dose of one modality without considering the impact on others or the patient's overall tolerance would be professionally unacceptable. This could lead to severe, unmanageable toxicity, compromising the patient's quality of life and potentially limiting the effectiveness of other treatments. Such an approach would fail to meet the regulatory and ethical standards of providing safe and effective care, potentially violating guidelines that emphasize balanced treatment strategies and patient safety. Another incorrect approach might involve prematurely abandoning a potentially beneficial modality due to perceived logistical challenges, without exploring all avenues for overcoming those challenges. This would be a failure of professional diligence and could result in suboptimal patient outcomes, contravening the duty of care. Professionals should employ a systematic decision-making process that begins with a thorough assessment of the patient's disease, including staging and molecular characteristics. This is followed by a review of current evidence-based guidelines and relevant clinical trial data. The multidisciplinary team then convenes to discuss the case, considering the potential benefits, risks, and feasibility of each treatment option, including combinations. Patient preferences and values are integrated into the final decision-making process, ensuring shared decision-making. Regular reevaluation of the treatment plan based on the patient's response and tolerance is also crucial. Question 17. The risk matrix shows a moderate probability of localized recurrence for a specific type of gynecological cancer, alongside a high potential for damage to adjacent healthy tissues if aggressive treatment is applied. Considering the essential principles of brachytherapy as applied in the context of Indian regulatory frameworks for radiation therapy, which of the following approaches best balances the need for effective tumor control with the imperative to minimize harm to the patient? Option A. Proceeding with external beam radiation therapy alone, as it is perceived as a less invasive option, despite the brachytherapy risk matrix indicating a higher likelihood of achieving local control with brachytherapy. Option B. Employing a pulse dose rate brachytherapy technique that allows for precise dose escalation to the tumor while minimizing dose to surrounding organs at risk, coupled with rigorous pre-treatment imaging and post-treatment dosimetry verification as mandated by AIPMT guidelines. Option C. Utilizing a permanent seed implant brachytherapy technique with a higher source strength than typically recommended for this tumor stage, in an attempt to achieve maximum tumor kill, without detailed consideration of long-term dose distribution and potential for late toxicity. Option D. Opting for a high-dose rate brachytherapy implant that delivers the entire prescribed dose in a single fraction, assuming that speed of treatment inherently reduces overall radiation exposure and associated risks. The correct answer is B. Employing a pulse dose rate brachytherapy technique that allows for precise dose escalation to the tumor while minimizing dose to surrounding organs at risk, coupled with rigorous pre-treatment imaging and post-treatment dosimetry verification as mandated by AIPMT guidelines. Explanation. Scenario analysis. This scenario presents a professional challenge related to the application of brachytherapy, complex medical procedure involving radioactive sources. The challenge lies in ensuring patient safety and treatment efficacy while adhering to stringent regulatory guidelines for radiation therapy. Professionals must make critical decisions regarding the selection and implementation of brachytherapy techniques, balancing the benefits of treatment with the inherent risks of radiation exposure. This requires a deep understanding of the physical principles, clinical applications, and regulatory frameworks governing radiation oncology. Correct approach analysis. The correct approach involves a comprehensive assessment of the patient's specific condition, the tumor characteristics, and the available brachytherapy techniques. This includes considering the dose distribution, potential for normal tissue complication, and the patient's overall health status. The decision to use a particular brachytherapy technique must be guided by evidence-based practice and align with the established protocols and guidelines set forth by regulatory bodies governing medical radiation in India, such as the Atomic Energy Regulatory Board, AIPMT. This ensures that the treatment is both clinically appropriate and compliant with safety standards, minimizing risks to the patient and healthcare professionals. Incorrect approach is analysis. An incorrect approach would be to prioritize a specific technique solely based on its perceived technological advancement or ease of implementation, without a thorough clinical justification. This could lead to suboptimal treatment outcomes or unnecessary radiation exposure. For instance, choosing a technique that delivers a higher dose to critical organs at risk, even if it offers a marginal benefit in tumor coverage, would be a regulatory and ethical failure. Another incorrect approach would be to disregard patient-specific factors, such as comorbidities or previous radiation exposure, when selecting a brachytherapy method. This violates the principle of individualized patient care and could result in adverse events, contravening the safety mandates of the AIPMT. Furthermore, failing to ensure proper quality assurance and dosimetry for the chosen technique would be a direct violation of regulatory requirements for radiation safety and efficacy. Professional reasoning. Professionals should employ a systematic decision-making framework that begins with a thorough patient evaluation. This involves reviewing medical history, imaging studies, and pathology reports to define the target volume and critical structures. Next, they must critically assess the available brachytherapy options, considering their physical characteristics, dosimetric properties, and clinical evidence of efficacy and safety. This evaluation should be conducted in consultation with a multidisciplinary team, including radiation oncologists, medical physicists, and radiation safety officers. The final decision should be documented, clearly articulating the rationale for selecting a particular technique and outlining the expected outcomes and potential risks. Continuous monitoring and quality assurance throughout the treatment process are essential to ensure ongoing patient safety and treatment effectiveness, in line with regulatory expectations. Question 18. To address the challenge of managing a patient who has received a significant dose of ionizing radiation and is now presenting for routine follow-up, a physician needs to determine the most appropriate course of action to monitor for potential long-term biological effects on human tissue. Considering the principles of radiobiology and ethical patient care, which of the following strategies best reflects a responsible and effective approach? Option A. Implement a long-term monitoring plan involving regular clinical evaluations, targeted laboratory tests, and imaging as clinically indicated, with a focus on early detection of both acute and chronic radiation-induced effects. Option B. Advise the patient that radiation exposure of this nature typically has no lasting impact, and therefore no further medical follow-up is necessary beyond the initial assessment. Option C. Prescribe a course of broad-spectrum prophylactic medications and recommend immediate surgical intervention for any organ system potentially affected by the radiation, regardless of current symptoms. Option D. Focus exclusively on managing any immediate, symptomatic complaints the patient may have, without considering the possibility of delayed or cumulative radiation damage. The correct answer is A. Implement a long-term monitoring plan involving regular clinical evaluations, targeted laboratory tests, and imaging as clinically indicated, with a focus on early detection of both acute and chronic radiation-induced effects. Explanation: scenario analysis. This scenario presents a professional challenge due to the inherent uncertainty in assessing the long-term biological effects of radiation exposure, especially when dealing with a patient who has received a significant dose. The physician must balance the immediate need for medical intervention with the potential for delayed radiation-induced injuries, requiring a nuanced understanding of radiobiology and adherence to established medical protocols. The challenge lies in making informed decisions about monitoring and treatment without causing undue alarm or undertaking unnecessary interventions, all while operating within the ethical framework of patient care and the regulatory guidelines governing radiation safety and medical practice in India, as relevant to the JEE/AIPMT syllabus. Correct approach analysis. The correct approach involves a comprehensive, long-term monitoring strategy that includes regular clinical examinations, relevant laboratory tests, e.g., complete blood count, thyroid function tests if applicable, and imaging as indicated by the patient's symptoms and the nature of the radiation exposure. This approach aligns with best professional practice because it is proactive, evidence-based, and patient-centered. It acknowledges the potential for both acute and chronic radiation effects, such as deterministic effects, e.g., skin burns, cataracts, and stochastic effects, e.g., increased cancer risk, and aims to detect them early for timely management. This aligns with the principles of medical ethics, particularly beneficence acting in the patient's best interest and non-maleficence avoiding harm, by minimizing the risk of undetected complications. Regulatory guidelines in India, while not explicitly detailed in the JEE/AIPMT syllabus, implicitly support such thorough patient care through General Medical Council regulations and hospital protocols that emphasize diligent follow-up for patients with significant medical histories. Incorrect approaches analysis. One incorrect approach would be to dismiss the radiation exposure as having no significant long-term consequences, and therefore not requiring any follow-up beyond the immediate post-exposure period. This fails to acknowledge the well-established principles of radiobiology, which dictate that radiation damage can manifest over time, and that even seemingly minor exposures can carry a cumulative risk, particularly for stochastic effects. This approach violates the ethical principle of non-maleficence by potentially allowing serious health issues to develop undetected. It also disregards the implicit duty of care expected of medical professionals. Another incorrect approach would be to recommend aggressive, broad-spectrum, and potentially harmful treatments without clear evidence of radiation-induced pathology. This could involve unnecessary surgeries or high-dose medications. This approach is ethically unsound, as it violates the principle of non-maleficence by exposing the patient to the risks of treatment without a clear medical justification. It also represents a failure in professional judgment by not adhering to a systematic, evidence-based diagnostic and management pathway. A third incorrect approach might be to focus solely on acute symptoms and ignore the potential for delayed effects. While acute symptoms are important, radiation can cause damage at the cellular level that may not become clinically apparent for months or even years. Ignoring this possibility means missing opportunities for early intervention, which could significantly impact the patient's prognosis. This demonstrates a lack of understanding of the biological effects of radiation and a failure to provide comprehensive patient care. Professional reasoning. Professionals faced with such a scenario should adopt a systematic approach. First, thoroughly document the details of the radiation exposure, including the type of radiation, dose, if known or estimated, and the affected area. Second, conduct a comprehensive baseline assessment of the patient's health. Third, develop a personalized follow-up plan based on the known risks associated with the specific type and dose of radiation, considering established medical guidelines for radiation exposure management. This plan should include regular clinical reviews, appropriate diagnostic tests, and patient education about potential symptoms to watch for. Continuous learning and staying updated on the latest research in radiobiology and radiation oncology are also crucial. This structured approach ensures that patient care is both ethically sound and medically appropriate, minimizing risks while maximizing the chances of early detection and effective management of any radiation-induced health issues. Question 19. Compliance review shows that a physical chemistry instructor, when explaining the properties of different types of radiation to students, incorrectly stated that X-rays are a form of non-ionizing radiation and that their primary hazard is the potential to cause minor skin irritation similar to sunburn. Which of the following statements best describes the most accurate classification and primary hazard of X-rays in the context of physical chemistry and safety? Option A. X-rays are a form of non-ionizing radiation, and their primary hazard is disruption of nerve signals, leading to temporary disorientation. Option B. X-rays are a form of ionizing radiation, and their primary hazard is the immediate and severe burning of skin upon exposure. Option C. X-rays are a form of ionizing radiation, and their primary hazard is cellular damage due to ionization, which can lead to long-term health effects like cancer. Option D. X-rays are a form of non-ionizing radiation, and their primary hazard is temporary heating of tissues, similar to microwave radiation. The correct answer is C. X-rays are a form of ionizing radiation, and their primary hazard is cellular damage due to ionization, which can lead to long-term health effects like cancer. Explanation. Scenario analysis. This scenario presents a common challenge in educational settings where the distinction between different types of radiation is crucial for safety and accurate teaching. The professional challenge lies in ensuring that the information provided to students is scientifically accurate and aligns with safety guidelines, particularly when discussing potential hazards. Misclassifying radiation can lead to either unnecessary fear or a dangerous underestimation of risks, impacting student understanding and future practices. Correct approach analysis. The correct approach involves accurately categorizing radiation based on its energy and its ability to ionize atoms. Ionizing radiation, such as X-rays and gamma rays, possesses enough energy to remove electrons from atoms, creating ions. This ionization process can damage biological tissues and is therefore subject to stringent safety regulations and protocols. Non-ionizing radiation, like visible light and radio waves, lacks this ionization capability and generally poses lower health risks, though high-intensity exposure can still cause harm through other mechanisms, e.g., heating. Acknowledging that X-rays are a form of ionizing radiation is fundamental to understanding their potential biological effects and the necessary precautions for their use, aligning with established scientific principles and safety standards relevant to educational contexts. Incorrect approaches analysis. One incorrect approach is to classify X-rays as non-ionizing radiation. This is a significant scientific and safety failure. Non-ionizing radiation does not have sufficient energy to ionize atoms. X-rays, by definition, are high-energy electromagnetic radiation capable of ionization. This misclassification would lead to a gross underestimation of the risks associated with X-ray exposure, potentially resulting in inadequate safety measures in educational demonstrations or discussions, which is a direct violation of safety principles and could have serious health consequences. Another incorrect approach is to broadly label all electromagnetic radiation as inherently dangerous without distinguishing between ionizing and non-ionizing types. While some forms of electromagnetic radiation are hazardous, this blanket statement lacks scientific precision and can lead to undue alarm or confusion among students. It fails to recognize that many forms of electromagnetic radiation, like visible light, are essential for life and are not inherently dangerous at typical exposure levels. This approach demonstrates a lack of nuanced understanding of the topic and an inability to convey accurate scientific information. A further incorrect approach is to suggest that the primary danger of X-rays lies in their ability to cause burns. While high-intensity radiation can cause thermal burns, the primary and most significant danger of X-rays stems from their ionizing property, which can lead to cellular damage, mutations, and an increased risk of cancer. Focusing solely on thermal effects ignores the more insidious and long-term risks associated with ionizing radiation, demonstrating a superficial understanding of the topic and failing to address the most critical safety concerns. Professional reasoning. Professionals in educational settings must prioritize accuracy and safety. When discussing radiation, the first step is to understand the fundamental physics of different radiation types. This involves recalling or referencing established scientific definitions and classifications. The key differentiator is the energy of the radiation and its interaction with matter, specifically its ability to cause ionization. Professionals should then consider the implications of these properties for safety, referencing any relevant guidelines or best practices for handling or discussing such materials in an educational context. When faced with uncertainty, consulting reliable scientific literature or subject matter experts is a crucial step in ensuring accurate and responsible communication. The decision-making process should always be guided by scientific accuracy, potential risks, and the need for clear, unambiguous information. Question 20. Compliance review shows a potential gap in understanding the mechanisms by which tumors develop resistance to radiation therapy, impacting treatment efficacy. Which of the following approaches best addresses this professional challenge within the context of essential physical chemistry principles relevant to radiation oncology? Option A. Investigating the underlying physical and chemical principles of cellular repair mechanisms, hypoxia, and genetic mutations that contribute to radioresistance, and how these might influence radiation dose and fractionation strategies. Option B. Prioritizing the acquisition of the latest radiation therapy hardware, believing advanced technology inherently overcomes biological resistance. Option C. Relying on historical treatment data and anecdotal evidence from colleagues to infer strategies for overcoming tumor resistance. Option D. Focusing exclusively on the physical dosimetry and calibration of radiation therapy equipment, assuming biological factors are outside the medical physicist's purview. Correct answer is D. Focusing exclusively on the physical dosimetry and calibration of radiation therapy equipment, assuming biological factors are outside the medical physicist's purview. Explanation. Scenario analysis. This scenario presents a professional challenge in a medical physics context, specifically concerning radiation therapy for cancer patients. The core difficulty lies in understanding and mitigating complex biological mechanisms that can lead to treatment failure. A compliance review highlighting potential gaps in understanding tumor resistance mechanisms necessitates a proactive and informed approach to ensure patient safety and treatment efficacy, aligning with the ethical obligations of healthcare professionals. Correct approach analysis. The correct approach involves a thorough understanding of the biological and physical factors contributing to tumor resistance to radiation. This includes knowledge of DNA repair mechanisms, cellular signaling pathways, tumor microenvironment characteristics, and the physical properties of radiation interaction with tissue. Best professional practice dictates that medical physicists continuously update their knowledge base to address emerging challenges in radiation oncology. This aligns with the implicit regulatory framework of ensuring competence and providing evidence-based care, as expected in any professional medical setting governed by standards of practice and patient welfare. Incorrect approaches analysis. One incorrect approach would be to dismiss the findings of the compliance review as purely biological and outside the scope of a medical physicist's expertise. This represents a failure to recognize the interdisciplinary nature of radiation oncology and the direct impact of biological resistance on the physical aspects of radiation delivery and dose assessment. Ethically, this demonstrates a lack of commitment to patient outcomes and a disregard for potential treatment failures. Another incorrect approach would be to focus solely on technical aspects of radiation delivery, e.g., machine calibration, beam shaping, without considering how tumor resistance might necessitate adjustments to treatment planning or dose fractionation. This is a failure to apply a holistic risk assessment, potentially leading to suboptimal or ineffective treatment. It violates the principle of providing the most effective care possible. A further incorrect approach would be to rely on outdated or anecdotal information regarding tumor resistance, rather than seeking current, evidence-based scientific literature and guidelines. This demonstrates a lack of due diligence and a failure to adhere to the evolving standards of the profession, which could compromise patient safety and treatment effectiveness. Professional reasoning. Professionals facing such a scenario should employ a systematic decision-making process. First, acknowledge the findings of the compliance review and their potential implications. Second, Engage in continuous professional development by consulting relevant scientific literature, attending workshops, and collaborating with oncologists and biologists. Third, critically evaluate existing treatment protocols and patient data in light of new understanding of resistance mechanisms. Finally, implement evidence-based strategies to optimize radiation delivery and potentially mitigate resistance, always prioritizing patient well-being and adhering to established professional standards.